and Lifestyle Hour on ETV, a program sponsored by Neo Care Clinic and Fertility Center, Mbarara. I'm Dr. Aheisibwe Hilary. I'm an obstetrician and gynecologist, but I'm also a fertility specialist majoring in embryology. Today is a great day to again talk to us, teach everyone, medical and non-medical, about one of the leading cancer death causes in our country and also majorly on our continent. And this is cervical cancer, or cancer of the cervix. So cancer of the cervix is a leading cause of cancer deaths among women, especially in our country, Uganda, and in sub-Saharan Africa. The last time we discussed, we saw that breast cancer was a leading cause of cancer deaths in women worldwide, with cervical cancer coming close, second or third position, depending on when the studies have been performed. But now we know in Africa, especially sub-Saharan Africa, where Uganda lies, cancer of the cervix is a leading cancer among women. I will start by discussing with us studies done locally. A study done at Mbarara University of Science and Technology on trends in cervical cancer shows that yes, we are achieving a number of milestones with a reduction in cancer deaths due to cervical cancer, majorly due to efforts that have been put through screening for the cancer and early treatment for those who are found with lesions. This study was done by Dr. Mayanja Ronald et al. I was part of this study and a number of other colleagues, and this study really shows that Mbarara as a regional referral hospital, but also as a region, Greater Ankole, the trends have been declining because of screening that has been involved. Screening is an effective method of preventing cancer of the cervix. A study still I did with colleagues on knowledge and healthcare seeking behaviors about cancer of the cervix among women in rural areas, a case study of Sinjiro district. We found that people in the rural areas of Sinjiro, where the study was carried out, did not know the signs and symptoms of the cancer. They did not know the causes, and very few of them knew that actually there was screening or had ever screened for cancer of the cervix, or even almost a number did not know that there exists vaccines that can prevent cancer of the cervix. This is a study done about 7 years ago by yours truly, that is Dr. Hilary Aheisibwe et al. And the studies I've quoted being done in this region are available for those who would love to do further reading on Google. You just put cervical cancer with Aheisibwe Hilary and you see the results. So what is cervical cancer? Cervical cancer is a malignancy of the cervix. The cervix is that part of the uterus closest or opening of the uterus. If I say closest to the entrance to the vagina, so from the vagina you reach the cervix, and that's the entrance into the cervix. So the causative organism is a virus that is known as the H. pylori virus, HPV, and this virus is sexually transmitted. So that means who is at risk? Anyone who has had unprotected sexual intercourse is at risk. We cannot really talk about cancer of the cervix without dedicating this show to the able leadership and sacrifice made by Dr. Mayanja Ronald, his soul rest in peace, towards eradication or reduction of cancer of the cervix in this southwestern region. He was a pioneer scientist who established the cervical cancer clinic at Mbarara Hospital and spearheaded a number of programs through camps and fought cervical cancer. So I dedicate this program to the gentle soul, Dr. Mayanja Ronald. What are the symptoms and signs of cancer of the cervix? Cancer of the cervix is largely asymptomatic. By asymptomatic, we are meaning that the patients do not feel anything right from the time one gets the disease. They will remain normal, they eat normally, they function normally. It's only until it is too late that patients start feeling symptoms. Now that is what makes the management of this disease very complicated. I mean, someone has not been feeling anything until it is late, and the symptoms they feel in late stages are painful sexual intercourse, bleeding after sexual intercourse, having an abnormal discharges through the vagina, low abdominal pain and back pain. Some may have pain around the thighs, and those are some of the symptoms. Of course, some will get a foul-smelling discharge, quite characteristic discharge. Of course, we talked about back pain, and a number of women will present with urinary symptoms when the cancer has really spread. So there are a number of investigations that we carry out to determine whether one has cancer of the cervix. Of course, the key investigation is actually preventive test or screening for cervical cancer. We have a number of techniques that you can do to screen for cervical cancer. The most common being called what we call visual inspection with acetic acid, or VIA. And in VIA is a short procedure taking about 3 to 5 minutes at maximum, including preparation. Mild discomfort, it's an office procedure. It can be done at the doctor's consultation room. It can be done in camps in the field. And in this procedure, it takes us only about 2 minutes, 1 minute, 2 minutes, 60 seconds to actually get a result and tell you that yes, we have screened you and you don't have cervical cancer. Other tests that may be used, especially for people who are older, we can do the pap smear. The pap smear, we take off a sample from the cervix, take it for the histology reviews, and within a few days, we give you results. These are the commonest methods. But with advances in science, we're also looking at a number of investigations using artificial intelligence, using nanotechnology, and those less invasive. Even the procedures I've talked about are really less, they are not invasive, they are painless, apart from the mild discomfort, and honestly there is no reason why one should not have screening for cervical cancer. Because we have seen that the purpose of screening, when the cancer is discovered early, it is very easy for it to be treated immediately. If discovered in the early stages, cervical cancer can be treated and can be cured. That's the absolute truth. When found late, then most of the treatment is largely supportive. So, if someone comes in and they have been screened and they are found to be negative, if the HIV positive, we usually recommend that they repeat a screening every 1 year. For the HIV negative, we usually recommend that they do screening screening after every 3 years. So that takes me to discussion on what are the risk factors for cervical cancer. Being HIV positive is a risk factor, or any disease, anything that can cause one's immunity to real go low. Diabetes, a number of other systemic diseases, autoimmune diseases, all can lower one's immunity and therefore predispose them to cervical cancer. Early initiation of sexual intercourse, in women. The girl had their first sex debut at a younger age, 15, 13, and even younger, they are more likely to develop cervical cancer earlier in their lifetime. Someone with multiple sexual partners, it again gets to the fact that HPV, the virus which causes cervical cancer, is a sexually transmitted infection or sexually transmitted virus. So that means one stands a very big risk of getting cancer of the cervix if they are having multiple sexual partners, of course having unprotected sexual intercourse with these people. Of course, there are family history of cervical cancer may predispose some people to cervical cancer, history of alcohol abuse, smoking, all those risk factors, and of course being black, being in our region, then one stands a big risk. We already talked about the smokers. I don't want to dwell so much on that. Now, when one has cervical cancer, all is not lost, depending at what level the cancer has been diagnosed. As we already said, it can be treated. There are a number of treatment modalities available. So the test, the VIA, we saw the VILI or the visual inspection with Lugol's iodine. We saw pap smear, then more advanced techniques called colposcopy, artificial intelligence techniques, nanotechnology techniques. All those have really come in to help identify these cancers when it is early. So when found, one, we grade the lesions. Some have what we call premalignant lesions. Now these are the ones most commonly discovered at the time of treatment or at the time of examination. So here we are able to treat by cryotherapy. We are able to do what we call the LETZ or the LETZ method. We are able to do colposcopy and still treat these women. I won't really go into the details of describing each of these procedures. Now, for those at certain stages who have malignant lesions, we are able to again go ahead and do total abdominal hysterectomy or modified radical hysterectomies, depending. These are procedures that are done locally by your doctors in Barara. Any gynecologist is able to do these procedures, and they really help to improve the quality of life of our patients, and for some, they actually get full recovery. So those are some of the treatments available. Of course, we are able to do radiotherapy in addition to some of the surgical techniques we have discussed. Radiotherapy in places like Uganda Cancer Institute in Mulago. This is a service that is actually available. Now, how are we going to prevent? And this is where I want really to lay emphasis. The key principle of prevention of cancer of the cervix is screening. Regular screening every 3 years if HIV negative, every 1 year if HIV positive. 2, we already discussed the risk factors. There are those risk factors that can be modified. I mean, if someone is a smoker, then they should stop smoking. If someone drinks alcohol, they should maybe moderate, take in moderate quantity. If someone has multiple sexual partners, maybe it's time to actually reduce. If someone has been having sexual intercourse, it's time to really make sure that the sex is protected. But in addition to this, we now have 2 vaccines on the market. Interestingly, the studies on these vaccines were carried out in Uganda, around the Mubende area, and the vaccines are now available using worldwide. And we hope that with this number of people, there is a generation that will have no cancer of the cervix. So we must present to the health facilities, to the immunization department or MCH department, every regional referral hospital has, and demand to be offered this vaccine for prevention. Now, we also know for those who are already sick and have advanced disease, still all is not lost, even with advanced disease. In our practice, we see people, yes, they are stage 3B, they are stage 4, stage 5, but even then, when treatment is done, the quality of life improves, and for a number of others, what we call the 5-year survival rate actually increases. Some grow some live on for more than 5 years, up to 10 years. So even when one has cancer of the cervix, diagnosed, if late, all is not lost. We have palliative care. Palliative care, we make sure that we add life to one's days. We make sure that a patient, even if they are going to die, they live their remaining days free, with good pain control, with good hydration states, with good, when they are not hungry, when they are not angry, and in a good state with their creator. So those are some of the principles that we look at while managing cancer of the cervix. Thank you. Yes, so I remain Dr. Hilary Ahisibwe, and as we discussed at the beginning, we cannot talk about cancer of the cervix without talking about the great work done by Dr. Mayanja Ronald, his soul rest in peace, especially for his fight against this cancer in the southwestern region of Uganda, but also for imparting on knowledge on cervical cancer to his students, to his staffs, to the midwives, and everyone in this room. Not only passing on, but ensuring that these people continue his legacy, continue the work in the fight against cancer of the cervix. Thank you.
No man should die giving life.
No woman should be childless unless by choice. Is infertility your nightmare? Not anymore. The solution you're looking for is at NeoCare Clinic and Fertility Center in Barara. Consider us for infertility treatment, sperm testing, artificial insemination, gynecology consultations, surgical consultations, minor surgeries, antenatal care, laboratory tests, ultrasound scan, and cancer screening. Find us in Barara, Kakoba Road, near Hotel Serene, or call us now on 0701 06 1848 or 0779 1069 56.
There comes a time when you just need to talk to someone about what's bothering you. That person is at Buhumuriro Counseling Center in Barara. Our team offers counseling services on HIV/AIDS, stress and depression, crisis, relationships, drug abuse, retirement, financial management, careers, antisocial behavior, and more. Find us in Kachenche, Kachika Division, Barara City, or call us on 0704 35 5359 or 0789 42 5402.